Hi, this is Dr. Josh Hustedt discussing weight loss with knee denervation procedures. The patient in today's video is a perfect example of how knee denervation can help patients with significant weight loss. One of the most difficult things for patients with advanced osteoarthritis and elevated weight is how to lose enough weight to qualify for a potential total knee or total hip arthroplasty. In most institutions in the United States, there's a cutoff of a BMI of 40, and if you're above 40, you're unable to have an arthroplasty procedure. The patient today presented to me after having failed conservative management with our arthroplasty and sports medicine teams after receiving cortisone injections and gel injections. She had significant osteoarthritis of the bilateral knees and very significant osteoarthritis of the hip. She had a history of gastric bypass, but still had a BMI above 40 and was unable to obtain or undergo a total knee replacement or a total hip replacement. She was told by the arthroplasty team that her only remaining option was chronic pain management with pain medication. After a knee denervation procedure on the left, she was able to return to full activity without pain. She was able to walk enough that she lost significant amount of weight and her BMI dropped below 40. After her BMI dropped below 40, she was able to obtain a right total hip arthroplasty. This is a major success story and highlights the benefits of a denervation procedure, which has lower risk in patients who have elevated BMIs, but allows them to become active and lose weight to undergo other arthroplasty procedures that are needed. So we have Sonia here with us today, and you had a knee denervation about 6 months ago now, right?
Yes, I have.
Tell me about what you're experiencing right now and kind of a little bit about the process.
Well, the process was, the denervation, I had it because I was having shooting pains coming up from my knees. Since the surgical procedure, it's non-existent. The only thing that I feel right now is just a little numbness, just in this general area in the bottom of my knee, but not where the incisions are.
Yeah.
It's in the bottom of my knee.
So we'll talk about that a little bit. I think, so one of the things that we do when we come in here is we take the nerves that kind of come up and underneath on both sides. The benefit of that is it's the nerves that actually go to the kneecap themselves. So we get rid of the pain underneath the kneecap. However, some people do experience a little bit of numbness just like kind of right in this general area, which you have normal here, normal here, normal here, but a little bit right over the anterior knee. But the super exciting part is we weren't going to do a total knee because you had excess weight.
Right.
And now you've lost enough weight that you qualify to get a hip replacement.
Correct.
Which is super exciting.
Yes. So I'm looking forward to that. Since the procedure, I have been walking more, which is why I think I probably lost weight because I haven't changed my diet or anything. I've just been walking more. And I think once I get the hip replacement, hopefully that'll just contribute to more weight loss along my journey.
It's amazing. You know, it's really important that we talk about this because before, when people had their weight was too high and their knees hurt, it's almost impossible to go out and encourage somebody to tell them they have to go walk more because what are you going to do, right? It hurts.
It's hard.
It's really hard. And so we send a lot of people to gastric bypass, which is a really big thing to have to send somebody to when we could maybe just do a knee denervation procedure and get you active and losing weight. So I'm super excited for you.
And part of my story is I did have gastric bypass 20 years ago. I was 380 pounds. So a lot of the excess weight that I have right now is just the loose skin that they need to take off. So that was one of the first steps that I did try 20 years ago, and I've still been on this journey. So I've basically lost, I was 380, I'm about 180 now. So I lost pretty much half of myself.
That's so exciting for you. It's so amazing. I'm so excited for you to be able to get your life back, to enjoy going for walks. What's it like going for a walk now?
Well, it's nice because I can go with my daughters because they're very athletic. They're in jiu-jitsu, so they always want to exercise. I'm able to have more endurance when I go to their tournaments. Just to be able to go, because I wasn't able to go to a lot of the tournaments just because I wasn't able to make it because a lot of them are convention centers. That's a lot of walking.
Yeah.
So now that I'm able to go watch them compete, it really has changed my quality of life.
So excited for you.
Thanks.
Congratulations on everything. You've done a great job rehabbing, and we hope you enjoy that new knee.
All right, thank you, Dr. Hustedt.
Arthritis in patients with elevated BMI or other significant comorbidities can be a very difficult thing to manage. If you have patients, family members, or yourself that are in this situation, please come and see us. We can discuss the benefits of knee denervation procedures, or find more information on joshuahustedmd.com or jointdenervation.org.